Hello and welcome to Rajya Sabha Television. You're watching The Big Picture with me, Frank Rausen Pereira. A crucial legislation for ensuring equal rights to persons affected by HIV and AIDS in getting treatment, admission in educational institutions and jobs has come into force. The Ministry of Health has announced implementation of the Human Immunodeficiency Virus and Acquired Immune Deficiency Syndrome Act through a Gazette notification issued on Monday. The act, which received presidential assent on April 20th last year, prohibits discrimination against such persons in as accessing healthcare, getting jobs, renting accommodation, and in admission to public and private educational institutions. The move comes after the Delhi High Court asked the centre why it has not yet notified the law to prevent discrimination against HIV and AIDS patients despite the statute receiving presidential assent in April last year. On this edition of The Big Picture, we will analyse the HIV and AIDS Act of 2017. Joining me on the programme today are Piyush Singh, Advocate of the Supreme Court, Amrita Sarkar, Senior Programme Officer, Sathi, Dr. Puneet Mishra, Professor, Community Medicine, AIIMS, and Aditi Tandon, Special Correspondent, The Tribune. Thank you to all my guests for joining me on this edition of The Big Picture. Piyush, I'd like to begin with you. Let's first put into perspective and try and understand what the HIV and AIDS Act of 2017 is.
Frank, we can divide the Act into two major parts, as the objective of the Act very categorically state that one is prevention and control of the spread of the HIV/AIDS. That is one, that's prevention and control. Second is protection of the basic human rights of the people suffering from HIV/AIDS. So for prevention and control, the Act mandates the central government with respect to also the state governments to formulate rules and also to have laboratories in place for assisting all those people who have been suffering with HIV/AIDS, so that this infection or this particular thing can be curtailed. That is one. Also, there is mandatory requirement which is supposed to be have by the central and state rules and regulation, wherein this every laboratory will need to have an informed consent and many other requirements for people who are suffering from it. With respect to the second part, which is protection of the people of the basic human rights of people who are suffering from it, the acts have various provisions with respect to their right to residence, their right to movement, their right to employment. Major of those clauses are with respect to non-discrimination. The basic objective of the Act, Frank, has been to curtail the major menace which the society is facing is the discrimination faced by the people suffering from HIV.
Right.
There was a huge discrimination in the society. People or the students who were let out from the school. There were people who were not given residence on rent, people who were suffering from HIV. There was discrimination in all strata, I would say, when it comes to employment to residence. So to curtail that also, the Act has made it an offence and have now this will be an offence. Anyone who violates the Act, it is punishable up to imprisonment of 2 years and a fine of 1 lakh rupees. Also, the Act has mandated every state government to have an ombudsman in place. So any complaint which is in violation of this particular Act can be made to the ombudsman, and ombudsman within 30 days have to deal with such complaints in the rule of law, with the presence of law.
All right, let me go across now to Amrita Sarkar. You know, we're talking about discrimination as far as people suffering from HIV and AIDS is concerned. How are members of this, I mean, I don't know how to put it really, but how are these people really discriminated against?
Actually, the thing is that it's not only the HIV status, but also means that for, from which particular community, the person belongs to. In HIV/AIDS sector, we call them key populations. Key populations, people who are mainly affected by the HIV/AIDS. He or she can be a sex worker, he or she can be a like MSM, male have sex with men, transgender women, people who inject drugs, truckers, migrant workers. So there are certain kind of a specific populations, and they are already marginalized in our society because either of their activity or because the kind of like identity or orientation they belong to. And above all, if they are suffering from HIV, then it comes to double level of discrimination. For example, recently Supreme Court has given the decision of this section IPC this 377. So that has been striked off. But till so far, it was very difficult for the people who are in same-sex relationship, because we are closely working for LGBT people. How difficult it was for them to get the proper treatment and all other necessary services if they are like from this sexually marginalized community. So I have gone through these bills.
So does the Supreme Court verdict on decriminalizing 377, have any bearing on members of this community in the sense who are suffering from AIDS, and does it help them now to get better treatment?
Actually, to tell you frankly, actually I'm also from the same community. I'm a transgender woman. So, I mean, we have gone through lots of challenges, and it's a huge among us of time, efforts, all our, time and everything. It took a very, very long time. So the thing is that it's just a beginning for our community. Beginning in the sense the people who are in same-sex relationship, they have been decriminalized. But it doesn't mean that, they have been given all the basic rights, basic needs and something. I'm giving a small example. I mean, being a transgender woman, where is my bed in a government hospital? No. Where is my mention in rape law, marriage law, adoption law? So there are still some areas which we need to work upon. Definitely there should be a beginning somewhere. This 377 judgment is no doubt it's a very important decision, but this is not the end of everything. So we have to work further. And similarly, this HIV/AIDS Act, I have also gone through in detail. So I didn't find it like anywhere it is particularly mention of this marginalized community. It's overall, it's generally talking about people who are suffering or affected by the HIV/AIDS. So I mean, slight work might have to be done.
Okay. More needs to be done as far as this particular act is concerned. Let me bring in Aditi Tandon now. Aditi, how will the act prevent and control the spread of HIV and AIDS?
See, as he very rightly explained, that there are two sections. One is devoted to prevention and control, where the act very categorically, for the first time in the history of India's fight against HIV/AIDS, which began around 2000 in a proper way, year 2000. For the first time, they are saying that antiretroviral therapy will be a legal entitlement of the patients, which means that all anti-HIV drugs will have to be freely available in all the state systems. We have, state AIDS control societies, and we have district level centers now. The government is providing free first line and now also to some extent second line antiretroviral treatments across its centers. But Frank, we have to understand that India is a very huge country. Implementing this law will not be easy. If you look at the data that we have in the public domain, the National AIDS Control Organization, it put out the 2015 estimates of HIV positive population. It said that only 9 lakh people out of 21 lakh people who are HIV positive, who are living with AIDS and HIV in the country, only 9 lakh are on ART right now. So you see the gap is humongous. The law is only a statement of intent. Application of the law is largely, a huge issue. They have said that, every state government has to provide ART centers, every state government has to provide screening facilities, diagnostics, whatever is required by HIV positive people. But whether the state governments will now deliver on the law, because see, health is a state subject. You see what has happened to past legislations in health sector. You look at the Clinical Establishments Regulation Act. It's a fine piece of law which was passed by the Parliament in 2011. The idea was to regulate private sector and bring down the costs of procedures. But only 7 state governments have implemented it. The ball is now in the court of state governments. Whether the state governments will match up their intentions with that of the centre, that remains to be seen. On the part of non-discrimination, the law makes a provision for an ombudsman at state capital level. In a country as huge as India, one ombudsman at state level, I'm not too sure whether that will work.
The act says one or more, but in all likelihood it could be one.
I can cite at least 10 examples where there are no grievance redressal mechanisms.
Yes,
laws are very beautiful on paper, but will they translate into reality? Only time will tell. Also, secondly, you and I have to remember that the majority discrimination is happening in educational institutions, employment settings. Now the law says that any establishment which is 100 people plus should have a complaints officer for anybody who wants to complain. Now I want to pose you a counter question. We have this law called the Prevention of Sexual Harassment at Workplace. We don't have those committees even today.
Yes, we don't.
I mean, we have to be very realistic. It's all about intention. The Parliament has spoken in one voice and passed this law. It's a very late piece of legislation. We have, not only controlled the epidemic, we have reversed it. And now we are nearing the end of the epidemic. The target year is 2030.
2030, yeah.
It has taken us so many years to bring the law. Now that the law is here, I think the state government's will and intention will be on test, whether they can implement it in letter and spirit, or they're again going to wash their hands off.
Implementation is key, is what Aditi Tandon is suggesting, and we have to ensure that we implement the law. It looks great on paper, but without implementation, nothing is going to come of it. Let me go across now to Dr. Puneet Mishra. Dr. Mishra, most of us, of course, are aware as to how AIDS is spread, and like Aditi Tandon is just pointing out, we seem to have reversed the trend as well. But some of those might not be aware of how exactly it spreads. If you could just educate us on that.
Very good question. We know that a lot of awareness program has been undertaken by government, especially by the National AIDS Control Organization in last few years, and because of which we could be able to reverse the epidemic. When in late 80s or early 90s, people, they were talking that India is going to be, AIDS capital, HIV capital in the world. But if you see if we go by just by the sheer number, then it's a huge number. We have around 21 lakhs people having HIV. But if you see from the point of view of prevalence in the percentage, right, it is 0.28, and mainly this decrease is just because of better programs which are mainly related with the prevention and awareness, and a lot of agencies, including non-government organizations, government agencies, they have worked in this area to create a lot of awareness. As we know, the main there are few very important mode of transmission of HIV/AIDS. As we all know, it can be spread through sexual route, whether it is heterosexual or it is homosexual route. The other very important is intravenous drug users, and then it can be from parent to child. That is, if a lady is pregnant, she can spread disease to a child. So that is the other modes which are important, maybe through blood which is taken from unauthorized blood banks, or it can be transmitted through if they are using unsafe needles, unsafe injections, which has been seen in some of the pockets. So these are the main ways of transmitting the HIV/AIDS.
All right.
Beside that, there are a lot of program awareness going on in the high risk communities, in the school population, in other groups as well, to make them aware, because we know the prevention is the key. We can prevent it very well. And since we do not have a definitive therapy, we have treatment for it which can prolong the life, can reduce the complications, other things, but we cannot eliminate disease completely as of now.
Right.
So prevention and awareness, that is the main key of for HIV/AIDS.
Prevention is the key as far as HIV/AIDS is concerned, is what Dr. Mishra is suggesting, and several campaigns have been carried out by the concerned authorities really to deal with this problem, and we have seen a reversal of the trend as such, and the number of cases has only come down, or the percentage has only come down with each passing year. Piyush Singh, taking the discussion forward now, of course, discrimination is one major aspect as far as the law is concerned. At employment, educational institutes, there are there's a list of things where people cannot be discriminated upon based on whether they have HIV or not. But what are the circumstances under which a person can be checked for AIDS?
Two important things, Frank. One is when we're speaking about discrimination, as you rightly pointed out. Discrimination is not only as you rightly pointed out, not only in schools and colleges or in employment, it is also in various fields, when it comes to residing, when it comes to movement, when it comes to marriage, a lot of other things. So when it comes to, there was a very interesting highlighted case of Benny and Benson, which was in Kerala. It was widely covered by United Nations in 2000. As Madam was rightly pointing out, in 2000 the real fight began. It was two children who became orphan after their parents died because of HIV, and they were also suffering from HIV. When their grandparents were taking care of them, the school denied, or the other parents objected to their admission in that particular school, and the school had to expel those two students because they were HIV positive. And after a long battle of 5 odd years, the students were taken back into the school, and after a period of 5 years, one of the child died. So that took the, I would say, the media glare of the complete world on the amount of discrimination we as a country are facing. For that movement, again, I come on to why such measures are required, because for, I would say, for most of the developed countries, they are majorly focusing on prevention and control, not for the protection of the human rights. Because nowhere in the world, like it's in, I would say, in third world countries, it's taken to be such a stigma, where you need to tell people what is the difference between a communicable disease and a contagious disease. Here we are in a country where a lot of awareness is required, that from very childhood हमें सिखाया जाता है कि AIDS छुआछूत की बीमारी नहीं है. Advertisements used to be all over there. 20 years down the line, we need to bring in a law wherein we need to tell people, all right, these HIV people will not be denied education, will not be denied healthcare. As again Ms. Sarkar rightly pointed out, 377 is just a step. It's a long way for us to go. One thing which I think this law lacked was, there were a lot of things to prevention and control which the government and state government needs to do. For prevention and control and for prohibition of protection of people's human rights, one of the most important things is protection of that fund. There has to be a fund which every state governments need to have in place for creating awareness in the schools, in institutions, in private and public institutions, whereby people can be aware about how AIDS is spread, one, and second, in case it is AIDS is spread or HIV is spread, that how it is communicable and how it is non-contagious to people who are just living around those things.
Right.
With respect to your question, with the restrictions and how those consent can be taken or those sample can be taken, one, if in case of any HIV person, he goes to any laboratory, the provision has his consent has to be taken before taking any of those samples. Secondly, even for any of the medical benefits which will accrue to him, his consent will again have to be taken for providing all those medical benefits which are going to accrue to him. So informed consent is there, and also informed medical procedures are there. So his medical or his consent would be required for performing any of those medical conditions.
At every stage of the way, the person's consent is required, is what you're suggesting. Yes. All right. Amrita Sarkar, what are some of the common misconceptions as far as AIDS is concerned?
Yeah, Mr. Piyush actually already pointed out that it doesn't spread through touching someone, and also like I'm a helpline counselor, so throughout the day in our NGO we receive so many calls over phones, over emails and all, so people still have some misconception, even they're literate enough, but they are not literate enough in terms of their sexual health, prevention of sexual health. So still they feel that if like they are having sex with someone, and even after using condom, they are not very sure that the infection will not spread. And there are so many circumstances sometimes, like if someone, like if having sex with us, like a sex worker or a call girl, then they are in a like major kind of depression after having sex, that oh my god, what I have done. So the thing is that it's not only misconception, it's also about to aware ourselves what is HIV it's all about and how does it spread and how it does not. There are so many things already available in internet and through various GOs and NGOs. So also like I'm love to talk about Sathi, the organization I belong to, Solidarity and Action Against the HIV Infection in India. We're closely working with NACO and all the state risk control societies. So apart from the targeted intervention program, running by that SACS, all these state risk control society, we are also implementing a community-based screening program that is running in 8 states of India. So it's not about that we are telling people to go and test, we are going to them. So we are like, it's kind of a mobile testing we are doing for particular community. It can be organized in a hot spot, it can be organized in a truckers point, in a cruising point. So I think the thing is that there are a couple of things while working in for HIVs, we have to keep it in mind. One, who are my audience? Who are my audience? I mean, whom I am concerned with. It could be like LGBT people, it could be like any other general community. That's number one. What kind of needs, basic needs they have, and if those are fulfilled or not. Because there are so many instances I have seen in my 20 years of working experience. Even it is HIV, if we think about their other basic rights. For example, when I started working in Orissa, there are some community people, they told me, madam, ये सब information तो हमारे पास already है, but पेट में हमारा खाना नहीं है, सब लेके हम क्या करें? So simultaneously, it's not only talking about sexual health, HIV/AIDS also, but somehow we have to cater, somehow we have to address the other basic needs as well.
Right.
That will actually scale up the program.
Okay, so it has to be a holistic
Absolutely.
approach is what
Yeah.
you're suggesting. All right. Aditi Tandon, well, are we well on the way of meeting our target to 2030, do you believe, of ensuring that AIDS does not spread anymore in this country?
No, I think we are well on the target as far as the numbers are concerned, because if you look at the last estimates, as I was just discussing, we now have 21 lakh people living with HIV, and we have much lesser AIDS related deaths. You know, we used to have about 1,48,000 people dying of AIDS in 2007, which was the previous estimate year. And in 2015, when the latest estimates of NACO came, from 1,48,000, we are down to 67,000. So look at the improvement, and look at the pace that we have gathered in our fight against AIDS.
It's not just half, but also let's not forget the population too has increased
absolutely,
tremendously. So
absolutely.
it could possibly be 1/4 or maybe even 2/6.
And also the new infections are much lesser than we used to have before. The latest data tells us that every year we have about 86,000 new infections. So you see, the target is this 86,000 new newly infected population. How are you going to reach them? Can you prevent HIV/AIDS in them? And then can you immediately bring them on ART therapy, like the doctor was saying, that you don't have complete treatment, but you can prolong the life. Now, government has taken a number of steps in that direction. But the challenge, Frank, is coming from states which were low prevalence in earlier estimates and which are now becoming high prevalence states. Because the initial stages of the NACO and National AIDS Control Program were so focused in the high prevalence states like Karnataka, Andhra Pradesh, Tamil Nadu, all mainly the southern zone and the northeastern states, that these states have made phenomenal progress. But the epidemic is now showing interesting trends of moving towards Punjab, moving towards Chandigarh, Delhi, Tripura, Assam. These are the areas which are still pockets of major new infections. So when you saw the 2015 data, you actually found out that national level there is a decline in new infections, but in these states that I've mentioned, there's a rise in new infections.
There's an upward trend.
Yes, there's an upward trend. So that is your key. The program has to now shift.
Right.
And
So
also,
that is so we have the symptoms, we have the signals there on what needs to be done, next.
Yeah.
All right. Dr. Puneet Mishra, what else needs to be done as if we have to eliminate AIDS by 2030?
What we are doing currently is testing. First, I'll go about my co-panelist was discussing about the new pockets they are coming up. So I would like to tell in little bit detail about it that we are having a program called Sentinel Surveillance Program, through which we keep an eye on these all the states in the country and in different groups, whether they are the antenatal cases, whether they are intravenous drug users, long distance truck drivers, or single male migrants, transgenders, in different groups. And we have different methodology for estimating these prevalence, and we get data from all over the country. Their defined methodology, and through which we are keeping an eye where it is rising and where it is decreasing. And in the places where it is rising, we as epidemiologists, we try to explain what are the different determinants to why it is rising. If previously it was low and now it is rising, or if it was high, it is decreasing. So we study different determinants, and based on those determinants, we give our recommendations that how can we reduce, and the results are in front of us, that we have able to reduce it significantly and reversal of epidemic. And as far as treatment and other facilities are concerned, if you see in all the hospitals, we have now ICTC center where patient they can go, they can get tested, and if they are positive, now government is providing treatment free of cost to everyone, right? And a few years back we were depending on CD4 count, that was a parameter on which we were giving the drugs, but now there's no parameter. If it is HIV positive, immediately refer to ART center, and from where we provide them treatment. So that is a very good step, I would say. And those patients, those who knew about their HIV status, around 67% of them, they are getting, or they are registered with ART center for getting treatment.
All right. So we are moving in the right direction as far as our target of 2030 of eliminating AIDS in the country is concerned, and we hope we meet that target. That's one target we have to meet at the end of the day. All right, closing comments now from all my guests, starting with you, Piyush Singh. Is there anything in the Act that is missing, do you think?
Frank, one of the major criticism of the Act is one of the provisions under Section 14, which states that the centre and the state government with respect to medical facilities should make efforts or should provide them as far as possible. So those words are as far as possible are being widely criticized. So everyone is saying that in case such a benevolent act was to be in place, whereas the state has to be formulating rules, such a provision which will give enough leeway to the state governments to play around with. So I think that could have been done away with.
Right. Amrita Sarkar, the best way forward?
Yeah, so we have to keep certain information in mind. The madam also correctly pointed out that focus was somewhere else, and it's spreading the epidemic somewhere else. For example, I think that currently it's Manipur, which is the country's highest HIV prevalence rate, that is 1.2%, followed by Mizoram and Nagaland. Similarly, if I talk about the different populations, like if I talk about my community, transgender community have 7.2% HIV/AIDS prevalence as of now. So we have to keep those pictures in our mind, and also like we have to go to the field level. Actually, it's very good to see all the information, all the policies, act, everything on pen and papers, but actually people who are implementing at the ground level and how difficult, what are the challenges, that's this bottom line to approach. So I think it's a time has come that we have to work like all hand in hand. It's not that government is working something, the people they are concerned about something, GOs are there, NGOs. It's not that. It's about the holistic approach. A comprehension approach needs to be needed. All people have to be ensured that they are involved. Either he or she is a community worker,
a combined concerted
a doctor,
effort is
either
required,
a government
is what you're
official. So a holistic approach is needed to find a problem.
All right. A targeted approach, would you say, Aditi, going forward really to address
Frank,
some of the problems? Because we
would,
know the problem areas now.
I am a media person. So I'll say what is going to work for this sector is, heightened awareness and heightened focus of society on this new law. See, we've seen there have been iconic films made on HIV/AIDS. We had Philadelphia, which starred Tom Hanks and Denzel Washington, drew the attention of the whole world to the problem for the first time. In India, we had a beautiful film, Fir Milenge, which starred Shilpa Shetty and Salman Khan. I think if the mass media gets involved in creating awareness about this law, so there's a social acceptance, and there is the stakeholders, widen their base, then HIV positive people are not the only ones who are affected. Then you are affected, then I'm affected. If the issue and the message is conveyed to the people, I'd be very happy to see some filmmaker make a great film on this law. Indeed.
All right. Closing comment from you, Dr. Puneet Mishra. Close the show for us with your concluding remark.
Yeah, so my concluding remark is the key is awareness, and it should not be only from the medical professional but from all the sectors of the society. And law will definitely help, but what I feel, how can you aware, how can you provide the right information, and if people they are rightly informed, if they know about it, then discrimination will definitely be less, and there will be a right way of treatment, and the people who are suffering, they'll get treatment. Those who are not suffering, they can be prevented. So awareness, and awareness.
Okay, awareness is what all our panelists are suggesting at this point in time. Thank you to all my guests for joining me on the program and putting things into perspective for us. That's it on this edition of The Big Picture. What's coming out is the Act ensures equal rights on paper, but what about the mindset of the people? That really needs to change on the ground, and only then can we see a change as far as HIV/AIDS too is concerned in this country. That's it from me. See you again next time.